Hello, everyone. My name is Yuz Yusof. I'm from Leeds. I'm reporting for Room Now for EULAR 2023 live from Milan. Today is day 3 of the Congress. And one abstract that I would like to highlight today is pertaining to Ancestry. The number is OP0290. As we all know, systemic lupus erythematosus, or SLE, is such a heterogeneous disease, and not only in terms of disease pathogenesis and disease features, but also response to therapy. So when we are talking about response to therapy, one key important message from this work was to think about Ancestry. So this is a study which the investigators analyzed a very large cohort of nearly 1,500 patients of lupus patients using the BILAG BR registry in the United Kingdom. So these patients have had a therapy with standard of care as a control, but they also have refractory disease and were treated with rituximab or belimumab. In this study, around 60% were of Caucasians or European ancestry, and about 16% were of a black in origin. We also got around 14% South Asian, and the remaining constitute Southeast Asian and mixed race. In this study, the purpose is to analyze whether was there any impact on ethnicity towards clinical outcomes of patients treated on these 3 therapies. What they found in this study were ethnicity were associated with poorer response, particularly people of black color. They have a reduction in major clinical response, which was defined by SLEDAI scoring 4 points or less by about 55 to 60% in both rituximab and belimumab. And also they also had a reduced effect in terms of conventional immunosuppressant as well. And another ancestry that also affected was South Asian, where there was a reduction in terms of effectiveness of treatment to about 71% in belimumab and also 35% in rituximab. So this study highlighted the importance to acknowledge ethnicity as a stratification factor, also as a prognostic factor when we're trying to treat the patients with biological therapies. This could be explain various reasons, and one of our study in Leeds, which we published last year, we did look at patients treated with rituximab, and we studied the interferon gene signature in bloods, and what we found at the times we categorized, because of the small sample size, we categorized between European and non-European ancestry. We found that in terms of the gene expression the score, there was some we can group it into 3 clusters, and there's one cluster that actually predicted poor response, which corresponded to interferon low and neutrophil high group. So potentially this could be one of the explanation why there was poor response in the non-ancestry descent. So I hope you find it useful, and follow me on my Twitter at Yuz Yusof, and follow Room Now either at Twitter, YouTube, or LinkedIn for more coverage at this year's EULAR. Thank you. Ciao.